Dysfunctional uterine bleeding is a condition that causes vaginal bleeding to occur outside of the regular menstrual cycle. Certain hormonal conditions and medications may also trigger dysfunctional uterine bleeding. The main cause of dysfunctional uterine bleeding is an imbalance in the sex hormones. Girls experiencing puberty and women entering menopause can have imbalanced hormone levels for months or even years. This causes sporadic bleeding, heavy bleeding, and spotting. Hormonal imbalances that cause dysfunctional uterine bleeding can also result from certain medical conditions or be side effects of medications. Causes of abnormal uterine bleeding. Polycystic ovary syndrome. This is an endocrine disorder that causes a woman to produce an imbalanced amount of sex hormones. This may lead to an imbalance in estrogen and progesterone, making the menstrual cycle irregular. Endometriosis. This condition results when the uterine lining grows outside of the uterus, such as on the ovaries. Endometriosis can cause heavy bleeding during regular periods. Uterine polyps. These small growths occur within the uterus. Although their cause is unknown, polyp growth is heavily influenced by the hormone estrogen. Small blood vessels in the polyps can cause dysfunctional uterine bleeding, including spotting between periods. Uterine fibroids. Uterine fibroids are small growths that occur within the uterus, uterine lining, or uterine muscle. Like polyps, the causes of uterine fibroids are unknown, but estrogen seems to play a role in their growth. Sexually transmitted diseases. Sexually transmitted disease that cause inflammation, like gonorrhea and chlamydia, may lead to dysfunctional uterine bleeding. Bleeding caused by sexually transmitted disease usually occurs after sex, when the lesions are aggravated. Pregnancy. Abnormal uterine bleeding can be an early symptom of pregnancy. Certain medications can also cause dysfunctional uterine bleeding, including birth control pills, hormonal agents, like spironolactone and tamoxifen, warfarin. Symptoms of abnormal uterine bleeding. The most common symptom of dysfunctional uterine bleeding is bleeding outside of your normal periods. It can also occur within your menstrual cycle. Suspicious bleeding patterns include heavy menstrual bleeding, bleeding that contains many clots or large clots, bleeding that lasts more than 7 days, bleeding that occurs less than 21 days from the last cycle, bleeding that occurs later than 35 days from the last cycle, spotting, bleeding between periods. How is dysfunctional uterine bleeding diagnosed? To diagnose dysfunctional uterine bleeding, your doctor will ask questions about your medical history and the history of your cycle. These answers will help them determine your risks for certain reproductive disorders, like polycystic ovary syndrome and endometriosis. If you're taking any medication, including birth control, mention this to your doctor, as such drugs can cause abnormal bleeding. Ultrasound. Your doctor may recommend an ultrasound to view your reproductive organs. This examination can help reveal whether you have any abnormal growths, such as polyps or fibroids. It can also help to rule out internal bleeding. Blood tests. Blood tests are used to measure your hormone levels and your complete blood count. Your hormone levels can often give quick insight into the cause of your bleeding. If you've had heavy or prolonged bleeding, a complete blood count reveals whether your red blood cell count is too low. A low red blood cell count can indicate anemia. Endometrial biopsy. If an abnormal growth is causing the bleeding, or your uterine lining is unusually thick, your doctor may take a sample of the uterine tissue for testing. If there are any abnormal cell changes in the lining, a biopsy may reveal it. Abnormal cells can indicate hormone imbalances or cancer, among other things. Is dysfunctional uterine bleeding treatable? There are many treatment options available for dysfunctional uterine bleeding. Sometimes, in cases of puberty especially, no action is taken, as the hormones usually correct themselves. The right treatment for you will depend on the underlying cause of the bleeding. The most common and simple treatment option for dysfunctional uterine bleeding is combination oral contraceptives. Combination oral contraceptives contain synthetic estrogen and progesterone. These both work to control and regulate the menstrual cycle. Can dysfunctional uterine bleeding cause complications? Generally, dysfunctional uterine bleeding is a temporary condition. Once the sex hormones are regulated, abnormal bleeding usually subsides. Anemia is one of the main complications of heavy bleeding. If you develop anemia due to significant blood loss, your physician may treat it with minerals and vitamin supplements. In rare cases where the bleeding has caused significant blood loss, you may need a blood transfusion.